Infection control factor in infection transmission cycle of infection. An infectious agent reservoir or the environment for the agent to live and the multiply. A portal of exit from the reservoir, a mean of transmissions, a portal entry into the susceptible new host. Direct touch droplet, indirect airborne formats vector. Summary: aseptic retard to growth of bacteria. Medical sepsis refer to the destruction of bacteria through the use of disinfectants, antiseptics. Surgical aseptics refer to the destruction of all microorganisms and their spore through the sterilization. The practice of medical asepsis is required at all times where surgical asepsis is required for invasive procedures. The single most important component of medical asepsis is proper and timely hand washing. A clean uniform must be worn daily. Uniform become contaminated and should not be worn elsewhere. Pathogenic and microorganisms thrive in gels, cervix, and crackles, nails polish. Infection microorganisms are transmitted by either direct or indirect contact. Direct contact involves the touch. Indirect contact include the airborne contamination, formats and vector. Infection acquired in a hospital are called the nosocomial infections. The most common nosocomial infections is urinary tract infection. The infection acquired hospital called this disinfectant are used in the hand washing liquid to kill microorganisms. Guideline standard procedure. The radiographer is now the legally as well as the ethically responsible for the strict adherence of the standard precautions principles identified in the following guidelines. Sealed for the fact I must be in the place whenever the possible of the blood or body fluid splashes may occur near the face. The plastic aprons must be worn whenever the possible of the blood or body fluid splash may occur in the cloth. The gloves must be worn whenever touching the blood or body fluid is possible, and whenever the handling equipment or the touch surface contaminated with the blood or body fluids is possible. Glove must be changed and the hand washed after every patient contact. Patient blood and body fluid spills should be carefully cleaned and disinfected using a solution of part bleach up to of 10 part water. Used needle must not be separated from the syringe and must be placed in design puncture proof containers. The prescribed procedure must be followed and sufficient care and attention given to risk tasks to avoid needle stick and other skin penetration for cutting instruments. Sharp emergency cardiopulmonary rescue CPR equipment must be include the resuscitation bag, mouthpieces. Summary: because no symptom may be evident in the patient affected within certain disease such as the HIV, AIDS, and hepatitis B, all patients must be treated as the potential sources of infection from the blood and other body fluids. This is the standard precaution concept. The practice of the standard precautions help prevent the transmissions of infections to health care professional and other patients. The healthcare professionals is legally and ethically responsible for the adhering to the standard precautions principle. They must be participate on the all patients at all time without the exception. The biomedical wastage, body substance, and their containers must be disposed in the carefully controlled circumstances. The transmission-based precautions include the airborne droplet and contact. The airborne precautions require that the patient wear a mask and admit to the private, specially ventilated room. The droplet precautions and a private room are the required for the measles, mumps, and the influenza. The radiographer require a mask. Patient is not wearing one and also may need to wear gown and gloves. The contact precautions required that the radiographer use mask, gown, and gloves when the direct contact with the patient. The mobile radiography is patient with the contact precautions required the teamwork of the two radiographers. The productive of reserved isolations used to keep the susceptible patient from the being infected. First question is pathogens are. The answer is sometimes harmful or capable to produce disease. Maybe D answer. Second question: disease that can be transmitted by direct contact include skin infection, syphilis, malaria. So answer will be two, three, first and second. B. And then the third question is which of the following conditions the protective or reserve isolation as indicate transmitted recipient, burn, and leukemia. So first and second will be B. So here first answer is pathogen are always harmful and sometimes harmful. And second is disease can be, that is 2 3, that one sometime harmful and capable to produce disease. Second is B. First second is skin infection and syphilis. Third one is the all. We need to reverse isolation, the transparent, burn, and leukemia. Fourth question. Fourth question is which of the following are being the direct transmission of microorganism. The answer is D. Vector, formate, and airborne, all of the indirect contact transmission of microorganism. The next question is which is the single most main effective controlling spread the infection the microorganism. The answer is hand washing. Hand washing controlling the spread infection microorganism. Next is what is the name and of the practice that served the retard growth of the bacteria. The answer is the antisepsis. The antisepsis is used to retard the growth of bacteria. Seventh question is which of the following disease airborne precautions. This is airborne precautions is the varicella. Next question is the radiographer must be perform following procedures prior to enter the isolation room with the mobile X-ray unit. Second answer is this one. They wear gloves, wear gown, mask, and gloves. Next question is limb disease conditions caused by bacteria by deer tick. The tick bite may be cause fever, fatigue, and other associated symptoms can be example of the transmissions of and the infection by. This is answer a vector. The tick bite is the vector, and the next which of the following transmission by the infected blood. The answer is AIDS and HBV. Thank you so much.